Welcome to the Deep Dive. Today we're tackling something that, well, probably hits close to home for a lot of you pet owners.
Yeah.
Those frustrating skin problems in dogs and cats that seem linked to their food.
Yeah, definitely a common issue.
We've got a really solid source here. Veterinary dermatologic food reactions. And our goal today isn't just to talk about food allergies. That term gets thrown around a lot.
Huh?
We want to really get into the nitty-gritty, you know, understand how these reactions actually work, what signs to look for, and how vets figure it all out. Think of it as getting you, the listener, really up to speed.
Exactly. Because adverse reactions to food, that's the sort of umbrella term, it covers more ground than just a simple allergy. It's really any skin issue that seems connected to something the pet ate.
Right.
And what's interesting, like you said, is it's not always the immune system doing what we typically think of as an allergic reaction. Sometimes it's
Yeah.
something else entirely.
Okay, so let's break down this adverse reactions idea then. The source splits it into a couple of main types. First up is food hypersensitivity. What's going on there, fundamentally?
So food hypersensitivity, that is the immune system getting involved. The pet's body reacts to certain components in the food, usually these molecules called glycoproteins.
Glycoproteins.
Oh, okay. Yeah, think proteins with like little sugar chains attached. It's often those specific combos that the immune system mistakenly flags as, dangerous.
Ah.
And the source mentions these can be immediate reactions. They call it type I, or they might be delayed, slower to show up, probably type 3 or type V reactions.
So type I is like, boom, hives appear quickly. That classic allergy thing.
Pretty much, yeah, that immediate response.
And the delayed ones are sneakier, taking longer to become obvious.
Exactly. Then you've got the second category, food intolerance. And this is quite different. It's not driven by the immune system. It's more about the body not being able to handle an ingredient properly, maybe metabolically, or the ingredient itself has some kind of, well, almost drug-like or toxic effect.
Like what, for example?
Well, think about foods naturally high in histamine. That's the chemical involved in allergic reactions, but here it's just present in the food itself. Or maybe something in the food makes the body release its own histamine. It bypasses the immune recognition step.
Interesting. So it looks like an allergy, but the mechanism is different.
Right. And the source points out, like we said, that adverse food reaction is the term vets often use day to day because, honestly, telling the difference between hypersensitivity and intolerance without specific tests can be tricky.
So it's a practical starting point.
Exactly. And another really interesting thing the source highlights is a link between these food reactions and atopy.
Atopy, that's the tendency to be allergic to environmental stuff, right? Like pollens, dust mites.
Precisely. And it seems like having an adverse food reaction can sometimes make a pet's atopic dermatitis, that general itchy skin from environmental allergies, flare up even worse. It's like one problem feeds the other.
Huh. Like adding fuel to the fire, basically.
Yeah.
Okay, so we know what we're talking about now. How big of a deal is this?
Yeah.
How common are these adverse food reactions?
Well, the source gives some numbers. About 5% of all skin problems vets see, and maybe 10 to 15% of all allergic skin problems in dogs and cats seem to be caused by food reactions.
So not insignificant.
Not at all. And here's where it gets more complex. A good chunk of dogs with food issues, the source says somewhere between 13 and 30%, also have atopy or flea bite hypersensitivity.
Wow. Okay, so they often come bundled together.
Very often, it's frequently not just one single allergy acting in isolation.
So where does it rank then, compared to other itchy skin causes?
It's definitely a major contender. For dogs, it's listed as the third most common itchy skin disease. For cats, it's even higher, the second most common. Though, the source does add a little caveat that these exact percentages might shift a bit depending on the vet practice and maybe the region.
Sure, that makes sense. Local factors. Okay, so it's common, often linked with other allergies. Who gets these reactions? Are there specific breeds or ages more prone?
We see it in both dogs and cats, obviously. Interestingly, for dogs, the source doesn't flag any specific breeds as being inherently more prone to the food reactions themselves.
Whoa.
But they do say that breeds known to be prone to atopic dermatitis might show up more often in studies, probably because of that overlap we just talked about.
Ah, okay, so it's more correlation than direct cause for the breed itself.
Seems like it. For cats, though, Siamese cats are mentioned specifically as possibly being a bit more susceptible.
Okay, Siamese cats. And what about age? Young pets, old pets.
It can really happen at any age in dogs, but the source suggests maybe a slight increase in dogs under a year old, or those over 7 years.
Mm.
In cats, it seems more common under 2 years or maybe over 5. But here's the kicker, and you touched on this earlier.
Yeah.
Many adult pets diagnosed with a food reaction have been eating the offending food for more than 2 years before they show any signs.
That's the really surprising part. 2 years. You'd never suspect the food they've been on forever.
Exactly. It tells you sensitization can be a slow burn sometimes.
What about male versus female? Any difference?
Nope. The source says there's no known sex predisposition, affects both equally.
All right. So it's widespread, can happen late in life, even with long-term food exposure. Let's get to the symptoms. What are the main things an owner might actually see that make them think, maybe it's the food?
Well, the source is clear that the signs can look a lot like other allergies, which makes diagnosis, a bit tricky sometimes.
Right.
But the absolute number one sign, the most consistent thing, is pruritus.
Pruritus. Just intense itching, right?
Intense, often relentless itching. That's the main flag.
Okay. Constant scratching. Are there other clues, maybe from the pet's history, that could point towards food over, say, seasonal allergies? Yeah, the source gives a few good historical pointers. One is if the itching seems to be kind of all over the body, not just focused in one area.
Mm.
Another big one is if it's non-seasonal, it doesn't get better or worse with the time of year. That often points away from things like pollen allergies.
Makes sense.
Also, a really key clue is a poor response to standard anti-inflammatory meds, like glucocorticosteroids. If a typical dose doesn't knock down the itch much, you start thinking about food.
Okay, that's a big one. Steroids not working well.
Yeah. And also things like recurrent bacterial skin infections, folliculitis, especially if there's no obvious reason for them, or persistent ear infections, that otitis externa, those can be linked to.
So recurring skin and ear infections, even without much itching sometimes.
Sometimes, yeah. Or the infections themselves cause the itching.
Gotcha. Are there signs beyond the skin that owners might notice?
Yes, though less common. Some pets with adverse food reactions also have gastrointestinal signs.
Like what?
Vomiting, maybe diarrhea, sometimes just really noisy guts, gas, needing to poop more often, things like that.
Okay.
And the source even mentions, though it says it's very rare, potential links to neurological things like seizures, and even some respiratory signs have been noted in dogs. So it's not always just the skin, but usually skin is the main event.
Right. Skin and itching are primary. Now, when you actually look at the pet, are there typical spots where these skin issues show up? Does it differ between dogs and cats?
Yeah, there are some classic distribution patterns. In dogs, you often see it affecting the rump area, around the tail base, the perineum, armpits, groin, face, and even down between the toes.
Okay, lots of potential spots on dogs.
Yep. In cats, it tends to be more focused on the face, the neck, and the ears. That head and neck pruritus is really common in allergic cats, including food reactions.
Face, neck, ears for cats. Got it.
And the source also specifically mentions something called the eosinophilic granuloma complex in cats that can show up as different kinds of sores or lesions on the skin or even inside the mouth.
The eosinophilic granuloma complex. Okay, something specific to look for in cats. Any other physical signs a vet might find on exam?
Oh, yeah, quite a few possibilities. In both dogs and cats, you might see those ear infections we talked about. Maybe secondary yeast infections, that's Malassezia dermatitis. You might see the bacterial folliculitis, little pimples or bumps, redness, crusts, scaling, hair loss from all the scratching and licking.
Self-inflicted hair loss.
Exactly. Sometimes it even gets misdiagnosed as psychogenic alopecia, like stress licking, but it's really driven by the underlying itch from the food.
Ah, okay.
You can also see actual scratches, thickened skin, maybe darkened skin pigment, hives, swelling, nasty hot spots, or those chronic lick sores, usually on the legs, called acral lick dermatitis. It's a pretty long list of potential skin changes.
Definitely sounds like it can manifest in many ways. Okay, let's circle back to the why. What's actually in the food triggering these things? You mentioned glycoproteins for the immune type.
Right. For the immune-mediated ones, the food hypersensitivity, it's usually those ingested glycoproteins acting as allergens. The body can get sensitized either in the gut itself or maybe after the glycoprotein bits are absorbed into the bloodstream, or both.
Okay.
And here's another layer of complexity, cross-reactivity.
What does that mean exactly?
It means if a pet is allergic to, say, the protein in chicken, their immune system might also react to a similar protein in turkey or maybe even beef sometimes because the molecules look alike to the immune cells.
So avoiding chicken might not be enough if they react to related proteins.
Exactly. And it can even happen between food allergens and environmental allergens, like pollens.
Wait, really? Food and pollen?
Yeah. It's less common, maybe, but it's possible. So a pet could have a flare-up that seems seasonal, but it's actually triggered by cross-reactivity between something they ate and the pollen in the air.
Wow, that complicates things.
It definitely can. And then for the non-immune reactions, the intolerances, it's simpler in a way. It's usually caused by foods that just contain a lot of histamine or substances that trigger histamine release through other chemical pathways, not involving the immune system's recognition process.
Got it. Now, do we know why some pets develop these reactions and others don't? Are there known risk factors?
That's still a bit murky, actually. The source says we don't have clearly defined risk factors pinned down yet,
Hmm.
but they do float an interesting idea. Maybe problems in the gut itself, like damage from parasites or infections, could compromise the intestinal lining?
Making it leaky, so to speak.
Kind of. If the barrier is damaged, maybe allergens are absorbed more easily or abnormally, which could then trigger the immune system to become sensitized when it otherwise wouldn't have. It hints that gut health might be pretty important.
That makes intuitive sense. A healthy gut barrier is key.
Hmm.
Okay, so a vet suspects a food reaction based on the signs and history. How do they actually diagnose it? You said there isn't one simple test.
Right, and this is super important. The source really emphasizes this. There is no reliable single lab test, like a blood test or skin test, that can definitively diagnose an adverse food reaction.
No magic bullet test?
Nope. Diagnosis relies almost entirely on doing dietary elimination trials.
Taking things out of the diet, not testing for things with a sample. What about those blood allergy tests some owners ask about? Do they have any role?
The source is pretty clear on advising against relying on those blood tests, the in vitro serum tests, for diagnosing food reactions.
Why is that?
Well, several reasons. They say there's often poor correlation between the test results and what actually happens when you feed the pet different foods. The results don't reliably predict clinical signs or the outcome of a proper diet trial.
So a test might say allergic to chicken, but the pet is fine eating chicken or vice versa.
Exactly. Plus, there's a lack of standardization between labs, and the overall reliability just isn't there for making a diagnosis or even for choosing which foods to use in an elimination diet. They're just not considered the right tool for this specific job.
That's really crucial for owners to understand. Don't hang your hat on those blood tests for food issues.
Okay.
So if those aren't the answer, what is the gold standard?
The food elimination diet, that's the definitive test.
Okay. What does that involve?
It means feeding the pet a very strict, restricted diet. It has to contain only one protein source and one carbohydrate source that the pet has ideally never been exposed to before. We call these novel ingredients.
Novel protein, novel carb, like
Mhm.
venison and potato or duck and green pea, something like that.
Exactly, something completely new to their system.
And how long does this super strict diet need to go on for?
You need patience here. The source says most pets show improvement within 6 to 8 weeks if food is the problem. But ideally, the trial should continue for up to 10 weeks to be really sure, unless there's dramatic improvement sooner.
10 weeks is a long time to be that strict.
It is, and using a home-cooked diet during this phase can be really beneficial
Why home cook?
because it gives you absolute control. Commercial limited ingredient diets can sometimes have hidden antigens due to manufacturing processes or cross-contamination. Home cooking avoids that, but you must ensure it's nutritionally balanced.
Right. You can't just feed boiled chicken and rice forever.
Definitely not. That's where resources like the website balanceeat.com come in. They help formulate balanced home-cooked recipes, which is critical, especially for a long trial.
Okay, balanceeat.com, good resource. So let's say the pet gets much better on this elimination diet. What's next? How do you confirm it was the food?
That's where the challenge phase comes in. Once the pet's skin is looking good, you deliberately reintroduce their original diet.
The food they were eating when the problem started.
Exactly. If the itching and skin signs flare back up, usually within days, that's strong confirmation that something in that original food was the trigger.
How long do you do the challenge for?
Usually just until the signs reappear, but the source says no longer than about 10 days typically. If nothing happens by then, maybe food wasn't the primary issue after all, or maybe it was something else in the environment that changed coincidentally.
Okay. And if the challenge is positive, the signs come back. How do you figure out which ingredient in the old food was the culprit?
That leads to the provocation trial. If the challenge confirmed the old diet was bad news, you put the pet back on the safe elimination diet until they improve again.
Right.
Then you start adding back single ingredients from the original diet, one at a time, usually for up to 10 days each, or until signs reappear.
So you'd add back just chicken for 10 days.
Right.
Then okay, maybe add back just corn for 10 days.
Exactly. You test the common potential allergens from the old diet, individually different meats, carbs, maybe egg, dairy if they were in there. This systematic process helps you pinpoint the specific trigger or triggers.
And that tells you what to avoid long term.
Precisely. It guides the selection of a safe, commercially available diet moving forward, or helps refine a long-term balanced home-cooked diet.
It sounds like detective work, really. Very methodical. What about other tests, like a skin biopsy? Does that help identify food reactions?
A skin biopsy usually can't give you a definitive, yes, this is a food reaction diagnosis,
Oh,
but it's still really useful. It helps rule out other skin conditions that might look similar things, like certain infections, mites, or even autoimmune diseases.
so it narrows down the possibilities.
Exactly. And when the pathologist looks at the biopsy sample, that's histopathology, they might see patterns of inflammation that are suggestive of a hypersensitivity reaction, which could include food. They can also spot any secondary infections like bacteria or yeast that need treating.
So useful for the overall picture, but not the final word on food specifically.
Okay.
Let's fast forward. You've done the elimination diet, the challenge, maybe provocation. You've identified the problem ingredients. What's the long-term management strategy?
It sounds simple, but it's crucial. Strict avoidance. You have to completely avoid feeding any foods, treats, or supplements containing the ingredients you identified as triggers.
Avoidance is key. What about managing the itch during the diagnostic process? It must be tough for the pet.
Absolutely. During the first few weeks of the elimination diet trial, vets often use medications to help control the itching. This makes the pet more comfortable and prevents them from damaging their skin further while you wait for the diet to start working.
Okay.
And of course, if there are secondary bacterial or yeast infections, those need to be treated concurrently with appropriate antibiotics or antifungal meds.
You mentioned earlier about being careful with meds during the trial.
Yes, that's really important for accuracy. The source advises avoiding antibiotics that also have significant anti-inflammatory effects, because that could mask whether the diet itself is helping the inflammation. And ideally, systemic glucocorticosteroids and antihistamines should be stopped for about 10 to 14 days before starting the trial, and certainly during the trial, to get a true assessment of the diet's effect on the itch.
Makes total sense. You need a clear baseline.
Yeah.
Now, this whole process sounds like it requires a massive commitment from the pet owner.
Oh, absolutely. Client education and compliance are probably the biggest factors in whether a diet trial succeeds or fails.
What needs to be emphasized?
Everything. The vet needs to explain the phases clearly. Owners have to be incredibly diligent. No treats whatsoever unless they are made only from the novel ingredients of the elimination diet.
No table scraps, no chew toys with flavors.
Exactly. No flavored medications. This is a big one. Things like chewable heartworm preventatives often contain beef or other proteins. No vitamin supplements unless specifically checked and approved. You have to read every single label.
Even toothpaste, potentially.
Anything the pet ingests. And if the pet goes outside, preventing scavenging is vital. The whole family, everyone in the household, has to be on board. One slip-up, one person giving a forbidden treat, can completely invalidate weeks of effort.
Wow. Total buy-in is essential. And you mentioned balanceseat.com for home-cooked diets.
Yes, if going the home-cooked route for the trial or long-term, ensuring nutritional balance is non-negotiable, and that site is a vet-recommended resource for formulating those diets correctly.
Okay, what about follow-up after you've got a plan?
Regular checkups are important, especially at first, maybe every 3-4 weeks, just to monitor the skin, the itching level, make sure things are staying on track.
And the main goal long-term is just prevention through avoidance.
Pretty much. Avoid all ingredients from the previous problematic diet, and always check labels on new foods or treats.
Are there common pitfalls or complications during this?
Well, the main complication is often coexisting problems. If the pet also has uncontrolled flea allergies or significant atopy, you might not see a complete resolution of signs even if the diet trial is helping the food component. You have to manage all the contributing factors.
Right, address the whole picture. So what's the general outlook for a pet diagnosed with an adverse food reaction?
Generally, it's good. If food was the sole or primary cause, and the owner can successfully avoid the trigger ingredients, the pet's skin should improve dramatically and stay that way.
That's encouraging.
It is. However, sometimes pets can develop new food sensitivities later on. It's not super common, but it happens. That might mean needing another diet trial down the road.
Ugh, okay.
And also, if the pet only gets partially better on the elimination diet, it strongly suggests there's something else going on too, likely that combination of food reaction plus atopy or another allergy.
So sometimes it solves the whole problem, sometimes just part of it. Okay, let's try to wrap this up. What are the absolute key takeaways for our listeners about these adverse food reactions?
I think the main things are: 1, these reactions are common in both dogs and cats. 2, they're complex, could be immune hypersensitivity or non-immune intolerance. 3, diagnosis isn't easy. It relies on meticulous elimination diets and challenges, not simple blood tests.
Right, the diet trial is king.
Exactly. And 4, long-term management really comes down to strict avoidance of the specific foods you identify as problems.
And hopefully, walking through all this detail gives you, the listener, a much better handle on what might be going on if your pet is itchy and what the diagnostic journey involves.
Yeah,
It's about being informed.
absolutely. And maybe it leaves you with a final thought to consider. Given that new sensitivities can pop up and food issues often exist alongside things like environmental allergies, what are the ongoing considerations for keeping your pet skin healthy long term, even after you've successfully managed a food reaction?
Yeah, that's a great point. It's not necessarily a one-and-done fix.
It often requires ongoing vigilance, maybe periodic reassessments, and always working closely with your vet. Keep learning, keep observing your pet, and don't hesitate to seek that professional guidance.